Hello, my name is Yvonne Field, and I'm the Assessment Specialist here at the Office of Public Instruction. This presentation will provide an overview of accessibility for students with disabilities. By the end of this module, learners will be able to describe disability types and some of the characteristics of students in each category, describe the difference between accommodations and modifications, identify the steps to adapt lesson plans for students with disabilities, identify the three main criteria in the Universal Design for Learning Guidelines and give examples of each criterion, and understand how to apply accommodations and Universal Design for Learning quality criteria questions to evaluate instructional and assessment resources. So who are the students we're talking about? There are 13 disability categories that are defined by IDEA. About 13% of the student population in the U.S. are students with disabilities. The chart on this slide represents the percentage distribution of children who are served under IDEA. Let's take a look at these in the order that they are represented in the school population. By far the largest population at 35% are students with specific learning disabilities. A specific learning disability means a disorder in one or more of the basic psychological processes involved in understanding or using language, spoken or written, that may manifest itself in the imperfect ability to listen, think, speak, read, write, spell, or to do mathematical calculations. The term includes such conditions as perceptual disabilities, brain injury, minimal brain dysfunction, dyslexia, and developmental aphasia. An example of a specific learning disability is dyslexia, which impacts a student's ability to learn to read with fluency. These students are usually reading below grade level, but their oral comprehension of text is at grade level. In addition to special instruction in foundational reading skills, these students will need help accessing grade level text via alternate modes, such as digital text or a human reader. The second largest group of students are those with speech or language impairments. These can range from speech impediments to issues processing language receptively or expressively. These students will need scaffolding to access speech and to produce speech. An example of scaffolding would be providing sentence starters and using graphic organizers to plan speech or produce language. The third largest group, other health impairment, means having limited strength, vitality, or alertness, including a heightened alertness to environmental stimuli that results in limited alertness with respect to the educational environment. These are due to chronic or acute health problems like asthma and ADD or ADHD, diabetes, and other diseases. Students with ADD may be easily distracted in noisy or busy settings. They may benefit from a small group setting and scaffolding to help them chunk assignments up into manageable tasks and to reorient themselves when they get distracted. The fourth largest group is autism, which means a developmental disability significantly affecting verbal and nonverbal communication and social interaction. Characteristics that are often associated with autism are engaging in repetitive activities and stereotype movements, resistance to environmental change or change in daily routines, and unusual responses to sensory experiences. These students benefit from explicit instruction, especially around navigating the rules and social expectations in the school setting. Concrete directions and scaffolding tasks are also useful. These students often struggle to communicate. Putting a communication system in place as soon as possible is essential for nonverbal students so that they are able to communicate wants and needs and participate meaningfully in grade level instruction. An intellectual disability means significantly sub-average general intellectual functioning, existing at the same time with deficits in adaptive behavior and manifested during the developmental period. A student with Down syndrome would fall into this category. Some, but not all students in this category may need a modified curriculum and might participate in alternate assessments. A characteristic of the group is that most cannot read fluently with comprehension. Text can be modified to define information, simplify language, and to have less text complexity. Developmental delay is used for children from birth to age 3 and from ages 3 through 9. The term developmental delay means a delay in one or more of the following areas: physical development, cognitive development, communication, social or emotional development, or adaptive development. Emotional disturbance means a condition exhibiting one or more of the following characteristics over a long period of time and to a marked degree. An inability to learn that cannot be explained by intellectual, sensory, or health factors, an inability to build or maintain satisfactory interpersonal relationships, inappropriate types of behavior or feelings under normal circumstances, a general pervasive mood of unhappiness or depression, and a tendency to develop physical symptoms or fears associated with personal or school problems. Often, a behavior plan will be put in place for children in this category. A stable, predictable environment can be very important. Multiple disabilities mean simultaneous impairments, such as intellectual disability and blindness, or intellectual disability and an orthopedic impairment. The combination of the two disabilities, would cause severe educational needs that cannot be accommodated in a special education program solely for one of the impairments. Often these students have very involved needs. This is the second largest population of students who participate in alternate assessments. Hearing impairment means an impairment in hearing, whether permanent or fluctuating. Students with hearing impairments may have special audio equipment that they wear that amplifies the teacher's speech. These students will benefit from non-auditory presentations of information to support comprehension. Orthopedic impairment means a severe orthopedic impairment. The term includes impairments caused by a congenital anomaly, impairments caused by disease, and impairments from other causes, for example, cerebral palsy. Students in this category may have physical limitations that require supports like speech to text or scribe, or may need assistance navigating the learning environment. They also might need special equipment. These are the main disability categories that make up 1% or more of the disabled student population. Other disability categories include deaf and deafblind, and you'll note that deaf is separate from hearing impairment. Students with traumatic brain injury, and also students with visual impairment, including blindness. One thing to note about these, a student to part of the definition for these students and the criteria for identifying a disability in a student is that the disability needs to have an impact on that student being able to access and achieve in that, and have it impacts their academic achievement. Often there's confusion about the differences between accommodations and modifications. Accommodations are changes to the materials or procedures that allow students to demonstrate abilities, but do not change the content that is being taught or assessed. Modifications change, lower, or reduce the learning expectations. Because the content that is being taught is changed, modifications reduce learning expectations and result in increased gaps in learning. Accommodations do not reduce learning expectations. Students who participate in an alternative or modified curriculum are not on the same learning trajectory as peers, while accommodations provide access to the same content as typical peers. The types of accommodations are presentation, response, timing, scheduling, and setting accommodations. Some of the types of modifications are prioritizing or learning less content, reducing the complexity of content, revising content or tests to make them easier, so you might see fewer answer options. There may be modeling, visual supports for texts and concepts, and scaffolding responses or providing hints and clues that lead to correct responses. In the next slides, we'll dig a little deeper into the different types of accommodations. Presentation accommodations allow students to access instruction in ways that do not require them to visually read standard print. Examples of visual presentation accommodations include large print, magnification, sign language, visual cues, notes, outlines, and instructors. And I won't go through the tactile, auditory, and visual examples. I'll let you, if you'd like to, pause the video and take a look at those a little bit deeper. I will go into the types of students who would use these are students with print disabilities or students with difficulty or inability to visually read standard print. And it can also include students with physical, sensory, or cognitive disabilities. Let's look at response accommodations. These allow students to complete assignments, tests, and activities in different ways. I'll let you read the examples on your own. Students who use response accommodations are students with physical, sensory, or learning disabilities, like memory, sequencing, directionality, alignment, and organization. Timing and scheduling accommodations are accommodations that change the allowable length of time to complete assignments and assessments and may also change the way the time is organized. Students who may have supports that will extend the time it takes to complete assignments and assessments are some of the students who need this. Students who have concentration issues or have limited ability to focus for longer periods of time would need these types of accommodations. Setting accommodations are changes in the location or conditions of instructional or assessment settings. Oops. Students who would use this type of accommodation include those that need a separate setting to reduce distractions, or if they need accommodations that would be distracting to other students or to increase physical access. For instance, a student might need to access special equipment that's only in one spot. So let's talk a little bit about modifications, and particularly we're going to talk about those in terms of using them for students with significant cognitive disabilities. And often these students participate in a modified curriculum and alternate assessments. So it is best practice for this population of students to move towards more inclusion. Content teachers can begin to work with special educators to identify opportunities for these students to participate in grade level lessons. And that's why we're including information on them in this module in thinking about formative assessments for all of our students. Special education teachers and content teachers each have an important role in including students with significant cognitive disabilities. The content teacher has a deep understanding of the content standards, while the special education teacher can provide guidance on modifications, scaffolds, and supports. The graphic here identifies 3 components of the alternative or modified instruction and assessments that students with significant cognitive disabilities need to access grade level content. Students who participate in alternate assessments use alternate standards that are reduced, simplified, and prioritized. These students are quite diverse in their needs and abilities, so a system of tiered supports and modifications based on student characteristics is the best route. These students struggle to read and comprehend grade level text. Modified text with reduced complexity and volume make grade level content accessible. On the next slide, we'll take a look at some guidelines for modifying text. Notice how the sentence structure is modified from compound and complex sentences down to simple sentences at the less complex level. Vocabulary is also adjusted from grade level to more commonly used or tier 1 words. Students at the lower complexity level are not asked to make implications from text. The theme is obvious. Let's move on. If you want, this might be a good place to pause the recording and examine the chart further. Now let's take a look at 2 processes for adapting instruction and assessments. One for students with disabilities who need accommodations, and one for students with significant cognitive disabilities. I'll give you a minute to pause the video. Well, you want to pause the video and read through these. This is a suggested process for adapting instruction or assessment for students with disabilities. It's useful to keep the first 3 points in mind when reviewing resources. A quality resource provides the information that educators need to adapt instruction for individual students. The 4th step and 5th step are best completed in collaboration with a special education teacher who can identify barriers and knows the specific accommodations that their students may need. In designing instruction and assessment, it might be useful to consider the major accommodations categories and include the supports and accommodations in planning for those major categories, especially when the resource is being shared by a larger group. Here's an example of how to adapt a lesson or assessment for students with significant cognitive disabilities. I'll go ahead and recommend that you pause this video and read through those really quickly. I've highlighted the differences between the accommodated planning and the modified planning. The main difference is to connect the general population standard with the alternative standard and to modify based on student needs. In creating inclusive assessment and instruction, working with the special education teacher in the planning phase, modifying to get help with modifying text and considering tiered supports and modifications and scaffolds is useful. Another way to build instruction that eliminates barriers for most, if not all students, is to use universal design for learning principles. Let's take a closer look at these principles and how they apply to creating assessments. These universal design for learning guidelines were developed by CAST. There are three main principles. The first is the idea of providing multiple means of representation. That means presenting information, content, and assessment in multiple formats so that all students have access. An example of this is to present information in a visual format or in an auditory format. The second principle is to provide multiple means of action and expression. This would allow students different ways to express or demonstrate their learning. So for a writing product, you might allow students to use a keyboard instead of a pen, or you might allow students to choose a format for assignments like writing a text, giving a speech, creating a film, or writing a song. The third principle is providing multiple means of engagement or stimulating students' interest and motivation for learning in a variety of ways. Some examples include providing options that include collaboration and communication, working with peers, and providing options that are relevant and authentic, like using money when teaching math or making culturally significant activities. When assessment and instruction are designed with these principles, barriers are reduced or eliminated for all students, including those with disabilities. Universal design for learning assessment should reflect the learning goal. For instance, if you want to assess students' knowledge of the life cycle of the frog and decide to have the students demonstrate their knowledge by assigning an oral presentation, then you're also asking them to demonstrate their ability to create an oral presentation. If the real learning goal is to show knowledge of the life cycle, then it's not important to define one way to show that knowledge. Allowing students to demonstrate that knowledge in more than one way will not change the learning goal. Providing flexible opportunities to demonstrate knowledge and skills meets the needs of students with disabilities who may have barriers if there's only one avenue for demonstration of the learning goal. By building in choice in medium or method, you're meeting the needs of all students, including those students with disabilities who need flexibility to address barriers to meaningful participation. So in the case of the life cycle, students might be able to create an oral presentation, build a model, or create a poster. Once teachers now have identified the goal, they can think of providing scaffolds and supports to address barriers to meaningful participation in assessments. When evaluating assessments, it's important to consider these characteristics of universal design for learning assessments. The next two slides include some questions to ask when evaluating formative assessments. First, are the objectives and student learning outcomes clearly identified? Are the instructional activities clearly described? What types of supports and strategies are already in place or are evident to make this formative tool accessible to all students? And finally, what types of supports come to mind that you think might be needed to include to make the formative tool accessible to all students? When evaluating whether instruction and assessment When evaluating instruction and assessments for universal design for learning, the following questions are a good guide. Is information and content presented in multiple formats? Are students provided alternatives to express or demonstrate their learning? And is there evidence of multiple means of engagement that stimulate student interest and motivation? In summary, using a universal design for learning approach in the design of assessments and instruction will make those accessible to all students. Planning with universal design for learning on the front end will make planning at the individual student level easier. Universal design for learning assessment should reflect the learning goal, provide flexibility for demonstration of mastery, allow for scaffolds and supports. The individual approach focuses on identifying accommodations in the IEP to help identify changes to the instruction or assessments that are needed for particular students. These resources can be used to dig deeper into the topics we've covered today. Thanks for participating in this module. If you have any questions, don't hesitate to contact me at the OPI.